here today. My name is Legal David, and I'm we have 20 tuned in online via our live stream, which is great as well. And I'd like to introduce our panel. So the session today will be chaired by Professor Emma Stokes. Apologies.
Emma Stokes is just fine.
Emma Stokes, who is the Vice President for Global Engagement here at Trinity, also the President of World Physiotherapy. Physiotherapy, you're most welcome, Emma. We're also joined by Dr. Alison Keogh, who is the academic lead on cancer innovation studies, which many of you know are interested in. And Alison is also a professor. Next we have Dr. Tanya Mulcahy, who is the Director of Healthcare Innovation Hub Ireland, and Healthcare Innovation Hub Ireland are actually a partner on our healthcare innovation. Yeah, and finally we are joined by Dr. Daniel Rogers, who is and has spearheaded this partnership. So, as I said, you're all very welcome to our panel discussion today. We're going to discuss healthcare opportunities, trends. You will also have the opportunity to ask any questions you might have about the course. So, would you?
Great, thanks Hazel. Welcome everyone, and welcome everyone online. It's great to see so many in the room and to know that there are so many of you joining us virtually as well. It's fantastic to be here. It's such a beautiful evening, and the campus is filled with the joy and excitement of our students returning, which is absolutely wonderful. This is a great panel, and I'm really curious to hear what they have to say. So my job this evening is to move proceedings along and to make sure that if you have any questions along the way that you either submit them in the chat box. Would that be right? Is that right for the people who are joining us virtually to submit questions?
Yeah, we'll receive questions at the end.
We're going to take questions at the end. Okay, great. So if you're thinking of your questions, pop them into the chat box and then we'll take them at the end. And for the rest of you, we might just hold off until the end and manage everything together. But if you have a burning question that you feel you can't wait until the end, then just signal to us and we will take the questions. So we're going to dive in, and I guess one of the questions that I'm really curious to understand is, in the last sort of 2.5, 3 years, there has been so much positive disruption in healthcare. Is everyone just worn out from innovation, or is there actually still an appetite? Are people sort of really thriving and sort of saying to themselves, look what was possible? And as the head of the HSE said at one stage, the systems were unlocked. So I'm just going to ask Alison, to what extent do you think there's an appetite for innovation in healthcare, as a consequence of COVID, or just as a consequence of the fact that we've kind of given ourselves permission to think differently?
Yeah, I think in general, I think you can't say that there is an appetite for it. I think healthcare professionals, by their nature, want to improve things for their patients. And if we look at innovation as a broad concept, it's about new things, new ideas, new challenges. And I don't think that just relates to kind of technology. I think we can think of like the big kind of solution, but actually small changes that improve patient care can be counted as innovation, whether they be within the system, education system, technology, whatever that might be. So I think some of the research that I've been doing recently has spoken to healthcare professionals, and they are looking for new ways to understand what happens to their patients, particularly at home. Because when we have someone in front of us, typically we almost see their best selves, because it's almost like an interview when you're with a healthcare professional. Then when they go home, you have the complexity of context, social environment, and psychosocial issues that all play a huge role. And I think that idea of remote monitoring and being able to measure things earlier and improve how quickly we can get into contact with our patients is something that people are really looking for. And I think, COVID showed us that we can do some things remotely, but that actually we still have a lot of innovation to do before we can really improve outcomes in the long term.
Great, super. Interestingly, in physiotherapy around the world, before COVID, most physiotherapy was delivered, face to face and, with very close proximity to people who were, with physiotherapists. And in the space of the first lockdown, perhaps the first 6 months, we surveyed the member organisations and asked, was digital practice permitted, possible, in your jurisdiction or country? And 70% of them said no, and then with about 6 months later, that had gone to 70% saying yes. And we have been looking, I would say that change would have taken a decade if we hadn't had COVID. The fact that it just flipped things so quickly. So that's just a really interesting context. And yet, I think the thing is, as you say, it's about getting it right, getting innovation right for the person who's inventing. I'm going to ask both of you, because I think, we all took this breath when we came out of COVID, and there's this desire to think it's all over now. And yesterday I was just thinking, we're heading into the winter, and it looks like it's going to be kind of a double whammy, the double burden of both COVID and flu. So, what do you think we've learned from the pandemic? And I'm going to ask both Alison and Tanya. And what do you think we've learned that's going to get us ready for this, apart from putting your mask on the public transport?
Well, I think first, the big thing we learned from COVID is that if there's a need, you have to address it. And the way they addressed it, using innovation. And in healthcare, we saw so many needs during COVID, from how are we going to treat people at home without getting them into hospitals, to how are we going to make sure that people are actually communicating with their healthcare professionals. And I mean, we talked about the appetite for healthcare innovation. Health innovation, we get ideas in all the time. We got over 500 ideas over the course of the COVID pandemic, and that's just telling you that people working in healthcare see needs and they have ideas for solutions. But just getting back to what Alison was saying, there's what COVID taught us as well is we have some ideas for solutions, but an idea isn't enough. You have to take that from an idea in your head or on paper and use the tools that people will learn through this program to develop the actual products that will work. So COVID has taught us lots of problems still out there. Technology can really help us. Changing care pathways can help us, and bringing in new processes can help us. But we have to use the tools to develop the right solutions. So I would say, yes, there's an appetite for innovation, and yes, COVID has taught us a lot, but we have a long way to go.
Yeah, I just follow up from that to say the need to adapt to what's in front of us, but also that we now, I suppose, we placed a lot of trust in data during COVID, and I think we can now start to predict things. Unfortunately, we might be predicting the winter may be tough, but then I think we can now adapt and plan ahead for that, maybe in a little bit more of a concerted effort than we maybe would have beforehand. So I think, what we've learned is that we can adapt quickly when we need to. So now why not trust ourselves to be able to do it going forward more often would be what I would look at.
I'm going to bring you in at this point, just in terms of some of the things. So, for instance, as Tanya was saying, people have great ideas, right? So they have this idea that something needs to change. What are the things that we need to understand as individuals or as organizations to get from, sort of walking around the department of wherever you work saying, this is really not working and I think this could make it better? What do we need to learn? What are the kind of things that we would consider on the course, or things that people can learn that would, the other pieces, the influence, the advocacy, the design thinking, all of that, what those kind of things do you think we need to address?
So I think one of the first things we need to address in an organizational context is how do we define innovation, and maybe also how do we measure it? So surprisingly, you'll find a lot of organizations don't have an innovation strategy. So they don't have key objectives, maybe indicators of success and KPIs associated with innovation. Bizarrely, people don't necessarily think, we can put metrics around these things, but actually we can. And, in order to see a measured return on investment in innovation, we have to do that. Innovation should be part of performance management. It should be part of how, I suppose, rather than having a department within an organization responsible for innovation, something actually should be embedded throughout, and maybe, an element of everybody's job spec to some degree. But also, I think culturally speaking, we need organizations to have a platform for fresh thinking, new ideas, fresh perspectives, a sort of a trust that organizations and teams within organizations can take ideas, prototype them, have permission to fail, develop insights, try again, that there's a culture in which that's not only allowed but facilitated and encouraged. I think that's really important. And having some clear tools and techniques associated and frameworks associated with innovation, all of which on our course in innovation, in healthcare innovation, our students would learn, they can then take back to their organization. They can apply them in a sort of, not just an academic exercise, but a real world application. Yeah.
And I think just one point on that is when they go back into their organizations, whether it's industry or their healthcare organization, they become ambassadors of change. They are the ones supporting innovation. They're the people you can go to. So I was just talking before this panel discussion about this course has been going on for a couple of iterations of it. But I've started meeting people as I go out to do my own work now who have done the course, and I know they're champions of change and innovation, whereas before you're going to be looking for the people who really appreciates innovation, who wants to see what's coming up and wants to take that risk. So our healthcare system is changing because there are now ambassadors of innovation out there, and our industry is kind of looking to support some of those activities as well. So I think it's a brilliant program to do. If I were, I want more people to do it. So when I go out to do my job, it's easier because I can approach people who've done it and they have the tools to innovate, which is good. And don't forget, you may not just be doing it because you're working in the healthcare system, but actually innovators within industry sometimes go out to create their own companies and become very, very rich is the word I'm basically saying. I'm trying to do it in such a nice way, but if you want it, the big companies and the big success stories are for people who have used their ideas, used innovation tools, and actually taken that risk to develop something. Yeah. So whether you're in healthcare or whether you're wanting to be the next millionaire, it's the tools that you learn through programs like this that really help you to do it correctly. Yeah. And then we address the problems of the healthcare system by doing that. So everyone benefits really, I suppose, in some way.
Absolutely. And if I could just add to that, many people who come on the program or who are interested in the program, they'll say, do I have to have a business idea? Do I have to be planning on having my own business? Actually, no, it's the diversity of the group that you get in a classroom from different backgrounds, from different sort of areas of expertise, but also different aspirations for the future that creates a real richness.
Can I ask a question though? And I think maybe some tangible examples of things that have changed as a consequence of being on this course would be very helpful, because I think a lot of people, perhaps in the room or joining us, on the live stream, will be sort of thinking, oh yeah, that's for someone else. Or I think sometimes we think the idea has to be big, and I think Alison, you touched on it, which is this idea that sometimes even a small quarter turn, which we wouldn't necessarily, I think, sometimes call innovation, but sometimes it is. It's just a quarter turn as opposed to this dramatic change. I think it would be great to just get some tangible examples so people can sort of say, oh yeah, actually I could do that. So who wants to dive in? I don't mind.
I've got one that is
absolutely.
It's pointing to physiotherapists actually.
Oh, fabulous.
So and it's a change in a pathway actually. Yeah. But we worked with a physiotherapist. I will say her name because she deserves the kudos. Siobhan Corcoran. She's from University Hospital Waterford, and she looked at, and it's about you learn about these tools when you're doing the program like this. She looked at what was wrong with the system she was working in, and she identified a need, a problem, and then she said, how am I going to change that? So basically it was patients waiting for, if they had knee osteoarthritis or if they thought they had needed surgery, they needed to go, they were on a waiting list because they were referred to the consultant. The consultant's waiting list was massive, the list kept getting bigger. But she was saying, if I could only go in and do a bit of physio on some of those patients, they'd never have to see the consultant. So she got permission to be innovative and developed a new pathway where they did a triage of patients while they were on the waiting list. She said, you guys urgently need to see the consultant. You guys don't. You're going to go in a physiotherapy program with me. And half of those people never needed to go see the consultant. So that is just innovative thinking, using tools and actually having permission from her organisation to take a risk and say, I'm going to do this. But that has had a huge effect on the waiting list, has had a huge effect on patients. And she is now rolling this out into other locations as well. So if you think then beyond that, so that was her, that was one individual person, and not everybody's like her. But if you think about maybe looking at that and saying, can we do digital tools that will actually mimic that in multiple locations, you could have massive impact. So that's an example of just someone not coming up with an I'm going to change the world kind of idea. Simple idea actually when you think about it, but really using her tools and methodology to actually make that change. So that's my hero example, because I think it's a huge impact on patients and it's really good.
Great, super. And the evidence would suggest that a very large proportion of people on waiting lists actually don't need surgery, that actually they will respond very well to increased pain, increased function through exercise intervention. So I think that was a great example of how taking a person-centered approach to a systems problem actually resulted in a great outcome. Alison, anything that you have, any kind of ideas or examples that you have tangibly from either where you were before or where you are now, or over the course of your over the last few years?
Yeah, I mean, it's not related specifically to the course, but like again, I suppose we come from a group that had a physio and an engineer actually working together on a PhD project that then decided they had a method to measure performance. And so they were able to take what would have been a room full of equipment that would have been very expensive to measure how people were moving and how well they were doing their movement, and put it into a tiny, tiny sensor. And they have set up a company because of that, and they're going off to the US, the UK. They have just grown and grown and grown. But like that, neither of them have come from business backgrounds, but yet they have gone through innovative pathways. They've learned the lean business model. They have networked with wider groups. They started with an idea. They started off with a scientific, person-centered background, and now have created something which is continuing to grow. So I think as you said, it can be a service thing, it can be a product, it all starts somewhere with an idea, whatever that might be. And if you get the right people in a room together, as you said, and start networking people, you just don't know what will come out of it.
Yeah, absolutely. And by the way, this was not pre-planned. The physiotherapy examples just happened to be physiotherapy examples. There are amazing other great examples of innovation in healthcare from all of the people working in various different teams.
Yeah.
And I think, also from people who live with particular conditions, who might either be working in healthcare or actually who are, our patients or clients coming and saying, well, have you thought about this, or have you thought about that? And I think that's the other aspect of this, is that, yes, this is designed for, for healthcare practitioners, but actually co-creating change with, patient participation is a really important element of this, particularly, I guess, in some of the design phases of things. So, Dan, can I get you to just talk a little bit more about the kind of details of what people do on the course? Because I think it will be really helpful to sort of unpack the black box of the course.
Yeah, for sure. So it's a postgraduate certificate, level 9, runs over 24 weeks, 8 of which is blended, partly online, partly in person. It's 3 10-credit modules, so 3 modules. The first module is innovation and creativity in healthcare. So that's where you really get to explore in a very experiential, interactive way the fundamental elements, things like design thinking, things like co-creating, as was referenced there, co-creating innovations in healthcare, and how to develop a sort of innovation mindset. So that's very much a team-based interactive module where you really get to kind of know each other very well, work on team-based projects. Then moving into the opportunity generation and recognition, this is really helping participants think more like entrepreneurs. So how do we become more vigilant and become more opportunity oriented in terms of innovation? So how do we identify the opportunities to implement innovation in examples, such as examples that were mentioned there? And then finally, there's an enterprise development module, which is around what are the nuts and bolts. And if I did have an idea that I wanted to bring to fruition and I wanted to develop as a business, how would I go about doing that? Where would I get the supports? And along the way through that journey, there's a huge opportunity, I suppose, to build a network within the class group, but also to access all of the other supports that exist within Tangent here, such as mentorship, such as potential accelerator opportunities, funding opportunities, etc. as well. So what we do find is the students that come on the course tend to benefit from the content, but they also benefit from the ecosystem and the network that they're a part of, and they return and stay a part of that beyond the course as well. Yes, absolutely. I couldn't have put it better. There's one myth associated with innovation, and that is the lone inventor, the person who has a eureka moment in the bath, and they now know what they're going to do, and they're going to do it themselves. But actually, it's teams that these things happen in, and we really foster that kind of culture within the classroom setting, where people work within, I suppose, what you might call multidisciplinary teams, but all within a healthcare kind of context. So you'll have people who are working in an admin setting, let's say in a hospital, working with clinicians, working with people, working with physiotherapists, and they're all coming together to, I suppose, look at what can be very complex problems and apply innovative solutions to them in that sort of multidisciplinary context.
And so just, I guess, give us an example maybe of people who've been on the course, is it quite diverse? Is it, flavor for the diversity of the course?
We've had medics, we've had surgeons, we've had senior hospital staff, we've had administrators, we've had physiotherapists, we've had
Industry people working in industry, because I've come across them.
Yes, lots of industry people, project managers in healthcare. We've had healthcare entrepreneurs. So quite a diverse group.
One of the things, Tanya, that you talked about, which I think is really interesting, and I think it will be just helpful to understand a little bit, is, and I guess certainly in my time working in healthcare, I worked actually in St. James' Hospital for a few years before I came to Trinity many years ago. But one of the things that I was really lucky was that I had these people who sort of said, off you go, go for it, try it out. And they let me go so far, and this the concept of the sort of positive disruptor. You can rock the boat as long as you stay in it. And I had so many people in my life, and I was really lucky, who would let me rock the boat enough, and then kind of catch me just as I was about to fall out. In the very early stages of my career. And they were amazing people, because they were sort of giving me permission to like as you said, to fail and that not to be dreadful. But can you talk a little bit about sort of the wider things that either organizations or teams need to have, for innovation to actually thrive? The sort of, I guess, the maybe the interpersonal or the organizational cultural pieces.
I think one of the things that has changed, so maybe when I started in my job, even if I just go back even to 5 or 6 years ago, people were afraid to actually talk about innovation or change. Actually, it was a little bit, I can't be a risk taker, I can't be seen to kind of think outside the box a little bit. So I think, and that has changed now, because there are courses like this that people can do. People can come to us with ideas and we can help them and support them. I think what in any organization, you need someone that's willing to kind of almost champion change. So I'm going to take the risk. And as you said, you might have been the one saying, I want to do it. So people have to have the guts to actually say, I want to do it. But then you need the people around you to support you. So just as you said, you obviously had the guts to go up and say, I want to try this. And some of them might have been going, madness, but leave her off and let's see where it goes. But every so often, one of those ideas is really good. So I think having the tools is something everybody, we should be, if someone is doing this course, when they go back into their organization, they should be trying to teach other people what they've learned, but they should also be driving that. So having the tools, having the guts, like a passion to make some of those changes is important. But that network, as you were saying there, getting the network to support you, I think, is really valuable too. So yeah, I just, the world is changing, and I think we look at innovation in a good way now, whereas before we might, if you failed, it was kind of not such a good thing. Whereas now I think you can do it, you can fail, you've learned a lot along the way anyway. So no one should be afraid to take that kind of step and that risk. Yeah.
And often when you're doing a course like this, I found that if I've gone and I've done something and I've come back to one of the teams that I'm working in, they do sort of cast their eyes to heaven, but you're sort of saying, well, look, it's my homework.
Yeah, absolutely. Yeah.
There's almost like that sort of, well, I have to get it. Yeah. Well, listen, will you give me a dig out here, because I'm doing this course and I have to do this project, and it'd be great if you could help. And that's often the thing that allows people to give you permission to sort of try the slightly airbrained scheme to try and get it over the line.
Yeah, absolutely. There was a previous participant who, as part of his homework, set up an innovation room that he managed to convince his boss to get for a trial period of time within the hospital, which was a collaboration space where people could come, meet, discuss opportunities to work together and build kind of collaborations for the purposes of innovation and incremental, frugal innovation, not big investment stuff, just small little changes that might be made to processes. And again, he was like, I have to do this for my course.
Yes, well, I have to do it. We had when I was in the Middle East for a few years before I came back to Trinity, and we set up an academic department there, and room space was at a premium, like in any academic institution or in any hospital department. They said, no, you can't have a coffee room. I'm like, no, we have to have somewhere. So we actually called it the Ideas Lab. So no, it's not a coffee room.
I'm sure coffee created a lot of ideas.
Exactly. It just happened to have a coffee maker in it, but it was called the Ideas Lab, and that was our space for innovating and meeting and having the conversations. But no, it was definitely not a coffee room. And we got away with it, and I kept thinking, and it was 3 years later, we still had the room, and I'm like, as I left, I was saying, do not let that go. Alison, in terms of the things that maybe perhaps, because I think sometimes we do have to think our way through what are the barriers that we're potentially likely to consider, especially if you're thinking about sort of change. It's about, okay, well, I think I'm going to bump into this, so what do I need to be doing to get around it? Any thoughts on what are the kind of, in your experience, the sort of bumps in the road that people have to think about dealing with?
Yeah, I mean, I think one of the things that I've come across is that, people do have, good ideas, but maybe the solution for their idea is not always actually there yet. And so actually, your barrier might be getting your idea off the ground, but then the challenge is to build a network that helps you to do that. So, for example, a lot of the work that I do brings engineers and data scientists in with healthcare professionals, because the healthcare professional knows what the patient needs. The data scientist might know how to look at those insights. The engineer might help you build the tool, but each of us on our own will ultimately fail. So I think the biggest thing is, I suppose, recognizing that we can't work alone, as we've already said, and actually then having the mindset to go out and to bring multiple stakeholders into this. If we try to solve it alone, we will fail. So we need to have policymakers, healthcare professionals from multiple disciplines, people from industry, regulators, whatever it may be, and that can be a little bit daunting to start with, but it's actually only by overcoming that barrier and merging all of our expertise and ideas together that you'll actually eventually find that solution. And sometimes you just need the people around you to go, I can do that for you. So I think just breaking down some of those walls that we maybe build up around ourselves. I think sometimes, particularly in healthcare, we're used to working in our own kind of little boxes. I'm a physio, this is what I do, and while I might communicate with the doctor or the nurse or the OT, we each have our own separate roles. But I think to really be innovative, we need to collaborate and not just stay within our box.
To what extent, can I ask, do you or can this course, or how does this course encourage? And I suppose I'm very much of the view that we need to take a person-centered approach to solutions. So to what extent do people on these courses, so sometimes it's a systems issue, right? So we can work within the systems and the ecosystem there. To what extent do we involve the lived experience in the solution finding? So for instance, if it's the person with osteoarthritis of their knee who needs to be doing exercises rather than surgery, or a solution for performance evaluation, how have you sort of had that way of bringing people who have the lived experience, the patient expert, into creating solutions, innovative solutions?
This is something I'm passionate about, actually. At being a public and patient involvement lead for a consortium, it is absolutely critical that we embed the lived experience in everything we do. We might think our idea is great, but if it's not meaningful to the people that we're creating it for, ultimately it won't go anywhere. So I think, they're just part of our stakeholders. They're part of the network of people that we need to bring in. How we do that, particularly for more minority groups, can be a little bit tricky, but most of us probably have, particularly those working in healthcare, patients that we would bounce ideas off ourselves, and actually turning around to them and saying, do you want to come to our next meeting? We're discussing this. It can just open the door for them to, and give them permission to say what they feel. And I think it is absolutely critical, because we may think we know, but they really know because they live it. And it would be the same if it's a systems-based approach. You need to talk to the administrators or the people that are using it. But we, at the very least, have to open the door for them. And actually, there are plenty of patient societies, there's public and patient involvement groups with an awful lot of patient cohorts and patient societies now that we can call on and that are just dying to be asked for their opinion. In the last couple of years, PPI Ignite has been set up in most of the universities. So again, there's areas that we can all knock on. We just need to actually make sure that they know that we're there, and vice versa. But it fundamentally changes anything that you'll do. We're very passionate about that element of it.
Yeah, and I think we can't teach people about design thinking, first stage of which is empathy, and say, but you can't talk to the people that because what'll happen is exactly what Alison said. We'll end up solving what we think the problem is, because we won't have actually spoken directly to the end user of the whatever solution that we're creating. But also it helps us get a really clear problem definition. So we're all sort of aligned in terms of what the problem is, and then we have a much better chance of coming up with something that's valuable in terms of solution.
I think the two things you said there, the problem. So you have to go to the people who are experiencing the problem. And that's what you learn through the course anyway. Because I know people would come to us and say, who've done the course, would come to us and say, could you give me people who are experiencing this problem? And they need to talk to them. But it's also about the end user. So sometimes the end user is the patient, but it's also the healthcare staff that are using the solution. You have to get to both of them. It might be a problem for the patient, but the clinician might have a different perspective on how that problem might be solved, so you have to get them both together. So understand the problem, understand who's using the tools you're going to create, how they'll impact the patient, how they'll impact the user who's implementing those tools. So, I mean, it's the fundamentals of the program anyway. You go through that as part of your process, and you learn how to do that. And the most successful solutions have gone through that process of patients, end users, and then bringing the network of people in different disciplines together, as you mentioned. So, yeah.
If we were to think about what, if you were to think about what success would look like in innovation in the next, in healthcare, in whatever setting, you can choose the setting, I don't mind. Choose your setting and say success would look like this in terms of how we would embed innovation in practice. In the next, you can choose your horizon. I'm going to say the next 5 years, but I don't mind if you choose a longer term horizon or a shorter term horizon. But give me some examples of what success looks like as a consequence of, say, you know, linking in with participating in this course. So what would success look like? You take a few minutes to think about it.
If we were to go big, I'd say if innovation can go to addressing equal access to healthcare services and delivery, so that your wait times are not dependent on, you know, your socioeconomic status. If innovation can address that, I think that would be fantastic. Yeah.
Okay, super. What's your time? What's your horizon for that?
As soon as possible. Yeah.
January. But yeah, and I suppose when you know, like a part of my role as well is we're trying to go out into the healthcare system and understand what they call their priority needs. And funny, we do it at a national level, so we do it at the HSE at the very top, and then we go out to all the hospital CEOs and the directors of nursing and the different levels of clinical staff. And at the top level, we always get waiting lists and things like that. But when you think about a waiting list, there's so many parts to a waiting list that you have to address. So us saying things that we'd like to solve the waiting lists, you need to actually drill down a little bit into that. So for me, I would love to, I would like to see innovation, people being allowed to say, tackle something like the waiting list, but actually not take it at that very top level. Tackle something like, just say, ophthalmology waiting list, but go back down to, let's start at the very beginning. What's the first thing the patient experiences when they come in? Can we try and solve the difficulties or the bottlenecks out there? So going the whole way along the patient experience, but also the system process, marrying the two together and taking little chunks of that at a time, putting in innovations into place. So it'll be tools and people working together to really address that waiting list problem. And I hate when people say waiting list because it doesn't mean anything to me. It's the elements of what's causing the waiting list problem that need to be addressed. So I know I keep talking about waiting lists, but there are loads of other things. One thing that has happened in our healthcare system, which is amazing, is now they are putting in innovation leads into different places. So you can go out now to a hospital, I can anyway, or if you're in industry or you've got a new idea, and you can actually talk to someone who's an innovation lead. Not everywhere, but I'd love to see them across the country. I'd love to see innovation leads in every healthcare organisation in the country. It would be fantastic.
That would be amazing. And wouldn't it be amazing if people with the lived experience could go to the innovation leads and say, hey, I've just spent 6 months being treated for this, that or the other in your health system, and actually here's a few suggestions for improvement. Yeah. And here's some ideas around it.
Involved in creating their own solutions as well. So, I mean, that's a lovely scenario for us to be in.
Well, you know, it's this idea of sort of communities, you know, we're shifting our healthcare systems much more into primary care, you know, shifting away from the sort of sick model of a health system to a wellness model, you know, where social prescribing or, you know, healthcare in communities becomes a much more super setting for healthcare. So in a way, innovating in that space as well as innovating further downstream.
And that's coming. I mean, that is coming, and it you know, they need lots of people thinking innovatively to allow us to do that. I had a fantastic chat yesterday with someone she's just got into her new role in the digital health space for community health, and she said she's going to be bringing 2 problems a quarter to us to see if we can work with people to find solutions. So I mean, the fact that someone in the healthcare system is now willing to say, I want to look at innovation to solve some of my problems in the community space, it's just, the world is changing, which is great, and we just need more people to kind of embrace that and deliver. So I want all of you to be doing that.
Yeah, I think I just kind of follow on from that. I was thinking that kind of wellness part myself, and kind of creating a system where people are confident to dip in and out of that healthcare system as they need, rather than reacting to something. I think that requires probably much longer than 5 years, but it requires us to be working at every level, as you said, the system and to the patient level, and then to bring things that are potentially outside, like technology and things that are not currently embedded in our system, into people's homes so that they can monitor themselves and start taking a bit of, I suppose, more informed autonomy and ownership, but in a way that they're confident about, rather than a way that just lets them feel that they've kind of been left to the side.
Yeah. And maybe that we never get sick in the first place.
But even better, yeah.
And then we're into the whole space of health literacy and empowerment and autonomy, and all of that as well, which I think, is really important, because technology is one way of looking at it, and then alongside that we do have to, as you say, when we're looking at the empathy maps, when we're looking at understanding this, there's a cohort of people for whom this will work. But then there's also a cohort of people for whom it's not going to work, and that has to be okay too, for lots of reasons. Yeah. I think it's about sort of recognising that there will be sort of more differentiated solutions. Yeah. Absolutely. Look, I'm mindful of the time, and I realise that we have done quite a bit of talking, so I would like to open up for some questions now, and maybe some questions in the chat, and then we might circle back around before we close the proceedings. So, do you have any questions or comments or reflections? If you'd like to tell us your name and the organisation you're from, that would be great.
My name is Anne. I'm a retired nurse, and I was involved for many years with the Irish Haemophilia Society. And I think that is actually what Alison was saying, their enthusiasm for patient contact groups. They have a very good example of how they work with the Department of Health, the consultants in the hospitals and the National Coagulation Centre, and they've actually formed a method of evaluating, because haemophilia care is so expensive. They've been able to they do a discussion over they're able to basically bring down the cost of treatment, which is the most important thing. And that seems to be a very successful approach. So, but I'm just wondering about the one thing that I haven't heard anyone say is about we haven't enough staff in the hospitals. We haven't enough nurses, we haven't enough doctors, we haven't enough consultants. We're told there's not enough GPs in the country. What are we going to do about that?
Great. Well, listen.
Because we're training them, but they're not staying.
They're not staying.
No.
But one of the things I think is our healthcare system has somewhat become very reactive to what's in front of you, treating the patients, focusing just on that. And I think, if I'd like to see the ideal healthcare system, it would allow people to take time out of that and be innovative and create solutions and feel like they're giving more to their profession as well. So I think Daniel mentioned it. It's important. It should be part of our job to be innovative, but actually we should be allowed to be innovative. So if you work in the healthcare system and you're given a bit of time to do that, you might find more people staying. It's just I can't solve the problem of staffing. I wish I could, but maybe we can try and create tools that take some of the inefficiencies out of the system. So we have huge inefficiencies in the system. We know that. Awful lot of time in Irish systems paper. Like there are so many things we could replace with digitizing, very simple processes, but we are not taking that step back and that big chance to actually put in these tools to do it. So one thing we need to do is start asking, if we work in the healthcare system, asking for more efficient solutions, because if we stay quiet and we keep the status quo, we're never going to be bringing those solutions in. So it's incumbent on everybody to think innovatively, but also to ask just a little, surely we can do this differently, surely we could do this with a better system. There must be something out there that we could use here to save my time so that I can spend more time on my patients. That's really what it's about. It's just, we haven't quite got there yet, but we'll get there. We will. But you have to keep having those conversations. So it's good that you say that, and we need to keep getting everyone to say that.
Staffing, yes. Yeah.
I think it's interesting that the example that Tanya gave, which I'm actually familiar with as a consequence of some of the physio stuff that I've done, is about this idea of advanced practice roles as well. And the idea that actually It doesn't have to be the traditional person I always went to see that is the person I'm going to see. And that's an innovation in itself, in the sense that it's about creating a new model of care. And so the advanced practice roles in physiotherapy and occupational therapy and speech and language therapy and nursing, they have in a way created capacity within the system, and they've also in a way also created a real sense of professional engagement and opportunity for professional advancement and development. So I think probably coming out of COVID, it's about sort of innovative workforce models as well, and bringing innovation not just to either products or services, but also to workforce models. I'm trying to sort of see in other parts of the world where that has been done well and where that has been done cleverly. And I think, you know, this is another aspect of innovation, which is sort of something that we do need to think about.
And we don't, not everyone has to see a consultant, and sometimes we have to tell the consultants they're not the only ones that know.
Exactly.
I hope no one here is a consultant, but really, in some cases, you know, we need to change that model.
Exactly. You know, I mean, we do have to, I think it is about that sort of sense of who is the right person to be seeing you at this point in time. And, you know, creating those shifts in expectations, I think, as well. So thank you.
Can I just add as well, I think we saw during COVID, you know, when something is prioritised by the government, money can be found, you know, so you know, when there's political will for something to be funded appropriately, not to say that healthcare professionals only work for money, there's so many other reasons why retention, you know, happens in organisations, but I do think, you know, we do have to look to our governments as well on this issue.
Absolutely. Yes, please.
I think like innovation is very multifactorial. So like it's government policy, it's do we have the staff to create the time to do it, etc. And COVID was great to allow us for innovation. There's kind of siloing as well going on. I realize people don't realize that this department within the Department of Health is doing this, etc. So I just want to ask the panel, data is obviously very important, and unique patient identifiers or individual health identifiers are important. Sorry, Patrick is my name, I'm head of the Army Medical School, but I've worked with the HSE in the pandemic response in terms of mass vaccination and trying to get and pull data. So I'm just wondering, like, what exciting things are happening in the healthcare space around, you know, patient identifying and tracking them as they go through the system. I'm just kind of keen, because I'm in defence, I don't really know what's going on, even though I'm a doctor, I don't really know what's going on in health too much.
I can't speak specifically for Ireland, but I know, like, again, like that in places like Denmark, where they have electronic health records and patient identifiers. If you see a physio, a GP, a consultant, whatever person you see in their health system, they will pull up your full record, where they don't have the kind of the bits and pieces and you have to transfer it here and there that we have. So I think having that whole picture of somebody would be one thing that we could look at. There's obviously, in terms of other identifiers, I mean, for different conditions and things like that, we're looking at genomics, we're looking at, you know, kind of going right down to kind of almost the DNA level of things, which is way beyond my area of expertise, but that in itself comes with complications about ethics and data sharing and ownership of that data, because even if it's anonymized, so if I give my data to anybody, no matter what it is, whether it's my blood pressure, my age, my DNA, what will they do with it? When can I take it back? Can I take it back? So it's the topic of data is highly complex, and I think there's now in Trinity we have the ADAPT Centre, which is very data focused. There's the Insight Centre for Data Analytics, which goes across a number of universities as well. So there are elements that are looking at this, and they all have health branches. So I think a lot of it is happening behind the scenes. But again, that requires consortiums, and it requires people to ask patients, to ask healthcare professionals, well, what is it that you need? What's your problem? So I think the solutions are out there. It's about knitting them together and as we said earlier, looking at what other countries do really well to see how can we model that into what's happening in Ireland.
One thing that's really interesting that I'm watching this space is that the EU have said that they would like citizens to have access to their personal health records. I think it's by 2026. I think maybe that seems really soon, but I'm just interested. I mean, it's going to be interesting to see how Ireland deals with it, because currently you actually don't have data in health records except on paper for most cases. I mean, there's a couple, you know, I know that the maternity hospital in Cork has all digital babies now, so everyone born there now has a digital health record. But that's not really linked into anything else. And as you say, the whole thing about the individual health identifier, we just need to solve that first, and then we can start putting the data onto systems and getting, even if you start from, as I was saying, the babies that are born now, and in the future we'll have it. But I mean, if I know, I lived in America for a long time, and I was able to just go in and pull all my children's vaccinations, I could pull my x-rays, I was able to see everything that I had been given as a drug at any stage. Whereas I couldn't tell you what I've had here. I couldn't tell you where to go for any x-rays I've had. I could go in at any stage now and say whatever I want to the doctor, and he'll not know if I'm telling the truth or not. So it's a problem we have in this country, and I'm not sure how we're going to solve it, but it has to be solved because, and there's a huge amount of value available in our data. So I would say one of the things, and don't be those people, please, I shouldn't be saying that, but I go out and we try to do, we have a new product and it's fully approved and it's got all the regulatory approval in place and we're going to implement it into a system, and I'm like, this is going to change everything, and the first thing I'm told is we can't do that because of GDPR, or we can't do that because of them. And it's just, it's a blocker. So we need to put systems in place that unblock that so that we can actually make those changes. And then, you know, you were talking about genomics, and actually spent a lot of my lifetime doing DNA analysis. So much valuable information in the data we're capturing. We're just not tapping into it properly yet. And as you said, it's siloed. There's bits and pieces all over the place. We're not linking them up together. But you know, can you imagine? I mean, I've done this. Sorry, I'm talking about myself now all the time. I shouldn't. I've gone out with my kid to my GP and I've said, I know what this is now because I've been here 3 years in a row, but he doesn't know that until he looks at his records. So if we had access to our own records, we'd actually be able to tell a lot about ourselves, our family, kids in the future, you know, that kind of way. So huge amount of information and data, and we, you know, there's opportunities to look into what we can do with it. So, but as you say, we need to be careful about how it's being used as well.
Well, Tanya, it can be a huge leap. Sorry, my name is Tanya. I mean, we've just been through an enormous revolution thrown at us by COVID, where we all have a record of our vaccinations. Yeah. We know the vaccination number that was on the vial. We know where we were when we got our vaccinations. It's not a huge leap from there to a universal patient identifier, surely.
I don't think it is. I don't know. I mean, do you know what's holding it? Do you know what's holding it up? I mean, I know at one stage they were talking about using PPS numbers, but then
it's recycled. It's siloing. It's the system's not able to talk to each other, from what I understand. So everyone in this room who's gone to a COVID vaccination centre has a unique individual identifier.
But that's on the COVID system.
Correct, and there are other systems where that is in existence. My understanding is, so like those digital babies probably have it, they just haven't been vaccinated yet. And it's linking everything up, because as you said, there are social determinants of healthcare. So if you know that children are going to school in an area that's DESH or a deprived area in their childhood, and then later on they're the ones who are all smoking or they're obese, you can then, you know, target interventions in those areas, you know, to save money, etc., etc. But it's just siloing. Yeah. You know? But if there, I know we all have access to we have access to our digital COVID cert. That was all on COVAX, which is the software system, but there was massive hassle and work that went into developing that. All it got done, but there was money thrown at it. Consultants.
And I guess what we need is a generation of people who are willing to be brave enough to innovate and brave enough to accept these changes. And that's where I think, socializing innovation in undergraduates, in pre-registration. So I'm obviously a physiotherapist, you can't work that out at that stage. We're all doomed. So one of the things is that we teach entrepreneurship to our undergraduate physiotherapists, and a lot of the time what I think is it's socialized out of them. So I think we have to be careful about what do we teach at pre-registration, and what do they see when they leave. And I think what we need to be sure is that in institutions, and this is what courses like this allow us to do, is to create an increasing core of people who have an innovative mindset. They may not be in that moment innovating, but one of the things they are doing is enabling others to do it. And I think it's that sense of creating an acceptance that things need to change. You may be needing the change at one point, or you may be supporting or following the change at another point. And I think if we start to create that culture of innovation, that culture of bravery to embrace the change, and then also, I guess, these advocacy skills to be able to go out and advocate for the change we want to introduce, Those are the things that are going to be important. There's an enormous political aspect to this as well, which is, I lived in Denmark and I lived in Qatar, and in both countries, there's a very joined up medical record. And then I come home here and I can't get my union, and I'm being slightly facetious. So I think in some ways it is about creating that culture of change being acceptable, change being driven by either the person living with the experience or by healthcare systems and people within healthcare systems. And the more people that we educate to have that innovative mindset and to have an understanding of what is required for change to take place, the more likely we are to have a swell or a support of people who will actually start to advocate for that. And then advocating not just within their institutions, but every time there's an election, trying to influence the programme for government. All of those kind of things. It's not just within where we are, it's about how we bring that out into the wider societal settings, I think, is probably that. Now, I'm mindful of the fact that we've drifted into a really interesting conversation, and I assume you have these wide conversations in the course as well.
Absolutely.
So I think, that's where you start to think about where do we go with this. And can I just ask, are there any questions from the chat? And then I'll just come back to you. I just want to make sure that we're bringing you through.
There was one question around commitment. Obviously, given the audience that we're targeting and the healthcare professionals are busy people. There was one question around commitment, and I know adult learners can sometimes be put off by exams, etc. So
I'm going to hold that for 1 second. It's not that I'm not going to come to it, but I think Dan will get you to kind of unpack the nuts and bolts of that in a few minutes. Can I just ask, could you tell us your name if you don't mind?
Sure. So my name is Marion Lovett, and I completed the healthcare innovation course last March, actually, along with Marion. This is my first time meeting Marion.
Hi, Marion. How are you
doing?
doing?
The course entirely online, and it was an absolutely excellent course in terms of the content and the individuals delivering the content. And amazingly, quite a strong camaraderie developed amongst the participants, despite the fact that it was online, and a lot of us keep in touch with WhatsApp, etc., etc. But then the course finishes, and how can I put it? I think that for entrepreneurs, going back to their workplace, yes, obviously it's possibly easier for them to maintain the innovative mindset of go forward with ideas and really advocate for change. But I think that if you're an independent entrepreneur, and I guess maybe I'd describe myself as that I have a very specific idea and I really kind of want to go with it, but I need to find the partners to develop. And actually I think it was Alison who said, well, really the challenge is to go forward and build the networks and to help you develop your ideas. And I guess what I'm saying is that, and maybe it's much a comment as much as a question, but maybe there's scope for Tangent and the Health Innovation Hub to maybe provide the forum whereby people can come together to, so I guess you guys could be the brokers for the matches that might possibly.
I'd love to do that. I mean, that's kind of one of the things we've been talking about, and we have a couple have come into us in the course recently. That's what we do. We kind of help you work. If you have a really good idea, how do you get the right people to actually develop that into a product or solution?
Yeah, and I know that I was quite interested in some of the courses, and I think some of them are offered online, but they're run by, let's say, the EIT, the European Institute, etc. But I think I was just really nervous about even applying for them once I'd finished the course, because it was kind of like, oh, I've done that, and now I'm kind of on my own.
Why don't you just approach us anyway?
Exactly. Yeah. So why don't we take this, because I think that's a really good point, and I think it's something that I know the team are talking about, which is how do you pick it up and keep running with it afterwards.
So I'm gonna, exactly my point.
Yeah. So I think that's something that's really important when you go away and you've reflected on it and you start thinking, now what do I do? So what I'm going to do is I'm going to ask you to pick up with the team after this, just so you can pick up that online, because I know we're running out of time. And Dan, I just want you to talk a little bit about the nuts and bolts of the course, what it would look like, what the commitment is, and all of that before we wrap up.
So brief synopsis. It's 3 modules, 3 10-credit modules, each run over 4 weekends with roughly an 8-week period. And Friday afternoons online 2 to 5. Saturday in person 9:30 to 4:30. So we have gathered lots of information from previous participants as to what the best time. It's very difficult to find time that works for all professions and everybody, but that's where we've arrived in terms of contact time. Runs roughly, course begins 20th of January 2023. We're actively recruiting. We have a number of sign-ups already. If you're interested, please talk to us here tonight. Please start your application sooner rather than later, and we can help you with that application. The course ends on the 17th of June, but applications close on the 8th of November, so that's not far away. So please do get your applications in. It is a HEA Springboard Plus funded course, meaning that if you are in employment, you are funded up to 90% of the course fee. If you're not in employment, you're funded 100% of the course fee. The 10% that you pay if you're in employment amounts to about €380, so it's a very affordable amount for postgraduate qualification from Trinity. And I've mentioned a little bit about what the modules are, just in terms of the assessment. So that's a question that comes up quite a bit. There aren't exams, simply because the kinds of skills associated with innovation are more about how you can actually demonstrate them in the context of the course. So it's continuously assessed through project work, team-based projects, reflective reports, written reports, presentations, pitch presentations, where you'll learn to articulate an innovative idea that you have in the context of the course, or something that you brought with you. And it's a strong sort of transversal skills component of the course. So learning about teamwork, learning about communication, leadership, problem solving. Yeah, fantastic. And I invite you all to input an application.
Could I add 3 things to that?
Please, yeah.
Former participant on the course. One is that the days that you're in class are so interesting you won't notice the time. The second one is that you don't need your own innovation idea going in. I didn't have one. I was madly envious of people like Marion who did, but it didn't really matter. And then the third one I have completely forgotten.
It was so much fun.
It was so much fun, yeah. No, it's definitely very much worthwhile doing. It's a fantastic course.
And it's such an important point. You don't have to have a business idea to come on the program. People come at various stages of their journey and have various aspirations that they'd like to achieve on foot of completing it. Yeah.
And you don't need a background in healthcare, my background. And I've ended up working as a project manager on an innovative program in healthcare as a direct result of a job I found when I was researching my healthcare trend for the module. Brilliant. What a fantastic story. Thank you. That's fantastic. Nobody knew I was coming this evening, so I'm not planning.
But what I think is brilliant is you kind of ask, the how hard is it to do what your question earlier, and I think one of the things you get is the confidence to say, why can't we do that? I think that's really important. The more you ask that, you'll find people say, oh well, but actually they go back and they think, why can't we do that? And that passes on to other people. Eventually someone will say, we can do it, let's do it. So
thank you. Any other questions at this stage? No? Okay, well look, you're here, we're here. If you have some questions in the room, by all means ask them. For those of you who are online, email springboard@tcd.ie or have a look at tcd.ie/tangent for more information. 8th of November is the closing date for applications, and the course starts in January, which is always a great time to start something, because it's like, the new year, and it's going to be a different new year. This year we hope to previous, more recent New Year's. So thank you to the panel. Thanks Dan, Tanya and Alison. Thanks Hazel for organising everything. Thank you for all being here and for everyone online. And that's a wrap. Great.